Hi, so for my fifth vlog, I am doing it on module 11, which is about health and medicine. So I decided to focus on the second and the fourth question. The second question states, according to the reading, a slow toxic decline, why is end-stage renal disease higher in African Americans than in white populations? Please give at least 3 reasons. Based on the course material this week, what health policies could be put into place to lower the racial health disparities? So the end-stage renal disease is higher in African Americans than whites for a few reasons. This reading was kind of like based in Louisiana, and one of these was being like the eating habits of them, or like the New Orleans cuisine, which can lead to obesity, which is correlated with the ESRD. Another reason is the high rates of hypertension seen in African Americans, which is a common cause for the ESRD. The last reason was talked about a lot just because there is a strong correlation shown, and that is diabetes. Some of the health policies put into action that can lower the racial disparities are like the Medicare and the Medicaid that were mentioned in one of the videos, also health insurance. America is known to have like a fee-for-service healthcare system. I guess a question that I have with like this question I'm answering is if like the high rates of hypertension that we're seeing in African Americans as like a common cause of ESRD, is that also linked to like the higher stress levels seen in African Americans, like because of the racism and discrimination? The fourth question states, in general, people of color have worse health outcomes. Please give 2 examples of these health outcomes. Why do people of color have more negative health outcomes? How is health inequity a form of structural violence? And why should doctors care about social justice? So my first example of people of color having a worse health outcome than white individuals is life expectancy. So in the population health crash course, it was explained that the white Americans have a higher life expectancy at 79 years versus the Black Americans, who have a life expectancy of 75.5 years. My next example is the negative birth outcomes in Blacks versus whites. In the population health video, it also mentioned that the Black Americans are more than twice as likely to die at infancy. These children were also more likely to be born in lower economic families who have like less access to health care. So that can be a reason to why people of color have more negative health outcomes. Another reason is racism or discrimination, which has been linked to the increase of cortisol rates in you, which can lead to like the premature birth in pregnant women. This is also like predominantly seen in the African American females. This also, like the increased stress, could be related to increases of other like stress related illnesses. A question I got from like listening about like that correlation of cortisol and the negative birth outcomes was if like certain racism like had greater effects on cortisol levels. Like, is it racism from like the general population, from like the workplace you're in, from media? Like, does that contribute to the increase of cortisol, or does like one racism have like a greater effect than the other? One way health inequity is a form of structural violence is that in low-income communities, there is a lack of doctors and hospitals that are seen, and if they are present, then like wait times are usually longer, and then unequal treatment is usually present. Another example is seen in the slow toxic death reading. In Louisiana, the group of people with their kidney dialysis fate, which was ultimately not receiving treatment, resembled on page 549. It states that it was a subset of Louisiana's many health problems, which included low immunization rates, high rates of stroke, diabetes, and heart disease, and deteriorating public health infrastructure. The problems were recognized to be of social origin, and because of the location they were in, these people were more dependent on having the dialysis treatment, but not receiving it. And then doctors should care about social justice because their role as a health professional is to not just treat the patient, but to sound the alarm, that was the words used in the TED Talk video, and advocate for change. And then doctors also hold a high society position. Many people depend on them, and that gives them more credibility for their voice. So that is all for this vlog.